just want to say that if I want to become Prime Minister of this country, it's because I want Canada to succeed in the 21st century. The climate change crisis is big. The cost of energy, fossil fuels going up is a big challenge. If we act now, if we do the great changes now, we'll succeed in the short term, middle and long term. If we avoid the issue as Mr. Harper is proposing to do, I'm very concerned for my country. It's why we need the Liberal plan. Everything we will do will be about providing more energy efficiency for this country.
Mr. Harper, Ms. May, let me just be clear about how we're dealing with the tar sands. First of all, in our plan, the toughest targets are on those who have the greatest amount of emissions. It's that simple. But secondly, we have a specific regime for the oil sands and also for coal-fired electricity. They are going to have to meet the requirement or equivalent of carbon capture and storage, which would reduce their emissions upwards of 70%. That's the target. And furthermore, I've said in this campaign, we will prohibit the export of raw bitumen so that companies cannot go around that tough target. That's the reality of our plan.
What's wrong with that?
We have the situation. We need to look at this issue of Mr. Giuseppe's territoriality. People don't understand quite what that means, but it's a good concept because it means you work together. What we need in Canada is not what's happening now. Just as when George Bush refused to act on Kyoto, your policies have forced provincial levels, municipal levels to try to create a patchwork to make up for the absence of leadership at the federal level. And just as on health care and on any other issue, Canada works better when there's federal leadership within a framework that brings everyone on board to pull in.
I think we have to explain what intensity target, base target are. Let's say it's an oil barrel. Mr. Harper is saying we'll reduce by 10% the pollution. It looks good. What he's not saying is that instead of producing 1 million a day, they'll produce 5 million a day. So it means at the end, more pollution. Absolutely. This is what intensity-based targets are.
Mr. Harper's plan has been rejected by everyone. Our plan has been well received by environmentalists and economists for a good reason. We are bringing together our economic, environmental, and social goals. We'll cut the taxes on the activities that are creating the wealth, like income, savings, investment, profits. We'll put the price on pollution, which will be good for the environment, and we'll cut the taxes, especially for middle and low-income Canadians, to have a fairer country. Richer, greener, fair.
Mr. Harper, I think I've been very clear about the tough targets that we are putting in place for the oil sands. Let me just mention a couple of other things we're doing on the environment, because I know there are other things that are important. We've signed an important agreement with the Nature Conservancy of Canada to preserve hundreds of thousands of hectares of environmentally sensitive land, mainly near cities. We've expanded our park system. We've protected the Great Bear Rainforest. We've expanded Nahanni. We've created the largest marine park in the world in Lake Superior and a whale sanctuary in Baffin Island. We've got a strong program to deal with indoor air quality, toxic chemicals. I could go through the list. There's a lot of good things that Canada's doing.
The only thing that you actually said it's true is the work on national parks. Well done.
Hello, I live in Quebec, where it's very difficult to find a family doctor or a pediatrician. It actually took about calling 75 places before I could find a pediatrician for my 6-month-old daughter. I'm very concerned about the quality of health care that we as Canadians are receiving. I wanted to ask, do you have any plans to alleviate the doctor shortage in Canada?
We put forward a plan to increase by 50% the number of doctors that we're training in Canada, and by 6,000 a year, the number of nurses that we're training in Canada. And more than that, we're going to forgive their student debts if they'll commit to 10 years in family medicine. And that will mean also that these doctors can go to more remote places across the country where they're desperately needed. But you know what, Mr.
Ottawa is not managing or administrating any hospital, the health department in Ottawa. But they're telling provinces and Quebec what to do. I think this is the old story of Ottawa knows best. Instead of intervening in the provincial matters, they should take care of what they're responsible for, like the Aboriginal conditions, which are awful, health conditions for the Aboriginal people, and food inspection. That be the time they take care of what they're responsible of instead of interfering in provincial matters.
In our healthcare system from a series of decisions that were taken in the early 90s. They had to do with tough deficit cutting. Jack Layton's made this point. It caused serious damage. We lost 21% of our hospital beds between the year 93, 94, 96, 97. And that period of cutting, it actually was interesting, did not result in the savings people thought, because when you don't have the hospital beds and you cut back on the doctors, you have sicker people staying in hospital longer. Our health care system needs people who believe in the full public provision of health care for everyone, and we need to reinvest in that. Yes, we need to make sure our doctors don't have student debts. Yes, we need to make sure that doctors and nurses operate in this country and that we have hospital beds to meet that need. It's urgent that we invest because right now under Chapter 11 of NAFTA,
5 million Canadians in the same situation who don't have a family doctor. We need to do something, especially because our doctors and nurses are aging. In fact, the age average of our doctors now is 50 years old. A lot of baby boomers will leave to retirement at a time where our population is aging too and is requesting more care. So we need to act. The federal government must be a partner. Yes, respecting the role of provinces. The provinces are asking us to be part of the solution. It's why a Liberal government will indeed invest to have more doctors and nurses and will work with provinces, with hospitals, and with the Association of Nurses and Doctors to make it through for Canadians.
Just say, first of all, that what Elizabeth May said is absolutely true, that there were dramatic cuts made by the Liberal government in the 1990s to health care across the country, and also cuts in schools that were producing healthcare professionals, and we are now seeing the consequences of that. What we've been doing is working with the provinces. This is an area where the provinces run the healthcare system and run the hospitals. So our approach as the federal government has not been to attack the provinces. It's been to work with the provinces. We're providing them with records amounts of money. In fact, we're increasing that money far more quickly than any other federal transfer, and we're proposing additional measures we can take to help physician recruitment, to help recruit healthcare professionals, and also to aid in specific areas where the federal government's research responsibilities can be helpful.
Thanks, Mr. Harper. I'll tell you one thing. The NDP brought public health care to Canada, and we're not only going to stand and defend it the way Tommy Douglas would want us to, we're going to expand it into pharmacare and home care and training doctors and nurses. And the way we're going to do it is cancel your tax cuts to Exxon.
Mr. Harper, you want to respond to that?
Let me just be very quick on this. I use the public health care system. My family uses the public health care system. In fact, in the last federal election campaign, at one point it turned out I was the only national leader, actually, who had used exclusively the public health care system. So, you know, that's the system we've got to fix for everybody.
Why don't you support it?
That's why we're making important investments.
I just understand that sounded like a shot. What is that a reference to?
Well, my understanding is that other leaders have used private clinics. I've never used a private clinic.
I've never used a private clinic. You live in Canada.
Always with the health insurance card.
Always use the health insurance card.
I've never used a private clinic.
Can we just explain what that's a reference to? I think that's a reference to the fact that you once went to the Shouldice Clinic, which is a private clinic, but the services are covered by OHIP.
Part of OHIP.
The health insurance plan.
You take a shot. You just accused me of wanting to destroy the healthcare system in this country.
Hang on, let him finish.
Our party has been committed strongly to a system of universal public health insurance in the country. That's why we created, for instance, in budget in 2007, an additional $1 billion fund to $600 million for wait time guarantees, another $400 million to help fund the Canada Health Infoway. In this country, we don't have permanent electronic patient records. That's one of the reasons we can't manage our waiting list properly. So these are investments we're making.
Why aren't you standing up to the privatization that's happening now, the for-profit medicine that's taking money away from doctors' and nurses' salaries and putting it into the pockets of corporations who want to come here and make money off it?
Without a Liberal government in the 90s, who had had a Conservative government, would not have health care anymore with the kind of ideology they had at that time. We saved health care and we put that on good footing. And we were ready to invest in 2006, and Mr. Harper and his party did almost nothing during that time. And the waiting list, it's a broken promise. You did not solve it. And we'll have a lot of difficulties to solve it if we don't answer to the questions of Madame Jacobs, and if we don't increase the number of doctors and nurses in Canada. This is key for the success of our country. And I have other ideas too, and I will have time.
The International Monetary Fund reported to Canada about our deficits in 93 and 94, that if we were going to be able to maintain our credit rating, we had to cut our hospital beds. That was in fact done by provinces and federal government in an invisible way that Canadians didn't see. Now we have NAFTA, Chapter 11, a suit filed by an Arizona businessman just recently to claim the right to move in to build a private clinic in Canada. Because what to us is a sacred trust, a universal health care system. To the U.S., big business and very, very expensive and very poor health care system. We are a market. We have to recognize that, yes, the Liberal cuts in the 90s hurt our health care system. Yes, we're seeing further pressure on our health care system. And yes, Mr. Harper,